Hi everyone, welcome to this video on the National Correct Coding Initiative, or NCCI. This video provides an overview of the program by introducing CCI and its background. My name is Tom Ryan with Provider Outreach and Education. I'll be the presenter for this material. The objective for this video is to understand the National Correct Coding Initiative, or NCCI edits. To do that, I'll start off with a definition, then explain the parts, and provide you with where to locate help. The NCCI edits are designed to promote correct coding. These edits apply to Part B services regardless of where they're provided. Also, Medicare does not consider whether they're provided in a facility or by a professional. Each has a set of edits. The edits only apply to the same provider for the same patient on the same date of service. There is one primary exception to the same date of service rule. This is for a once-in-a-lifetime benefit. Now that you know the basics of what the edits are and how they work, let's move on to the three parts of the edits. What are the three parts? Let's start with the one most people are familiar with. This is the procedure-to-procedure, or PDP, edits. Next are the medically unlikely edits, and last are the add-on code edits. Next, I'll take a few minutes to explain each set of edits. Let's start with the procedure-to-procedure, or PDP, edits. Medicare uses the PDP edits to ensure that two procedure codes are not paid when one would have been more appropriate. Examples would be a component of a more comprehensive procedure, or two services that will give you the same results, such as a virtual colonoscopy and a colonoscopy. These are automated edits added to the system by CMS. This means that a person does not review the claim. CMS breaks these edits into two types of edits. First is your never payable combinations. These codes cannot be separated regardless of what the provider documents. The other type of PDP edits are sometimes payable. This is based in the documentation, and you must append a modifier on the claim to separate the two procedure codes. On their website, CMS provides a list of when you should append a modifier and when you cannot append a modifier. There's a link in the description below to the NCCI section of the CMS website. The next set of edits is the medically unlikely edits, or MUEs. These are a set number of units that can be commonly performed. They are divided into three types. 1. Date of service edits, 2. Billed line item edits, and 3. Lifetime edits. View the MUE section of the CMS website to determine the MUE number for that line item. The system automatically denies anything above the number of units in the edit. In most cases, you can build two lines, one with the number of units up to the edit, and the second line with anything above that and a modifier. The exception to this rule is when there is a once-in-a-lifetime benefit offered by Medicare. We receive a question commonly about MUEs, and that is, are all MUEs publicly available on the CMS website? CMS does not publish all MUEs on their website. This is due to fraud and abuse prevention. You will build one line item with the correct number of units for that date of service. If that line item denies for an MUE edit, file an appeal to show the medical necessity for all units billed. The last type of NCCI edits are the add-on code edits. These are the same edits as published by the American Medical Association, or CPT, edits. Add-on codes are when a procedure must be done with another procedure. A primary procedure is payable without the secondary procedure being done. The secondary procedure is only payable when the primary procedure is performed and billed. An example of this is an additional 15 minutes after the first 15 minutes has been billed. CMS provides a list of these add-on code edits on their website. The goal of this list is to add them to the system so that everyone is aware of them. It is not to override the American Medical Association add-on codes. I've mentioned modifiers a few times in the previous slides. Let's explain those just a bit further. First, modifiers can be used to override the procedure-to-procedure edits in some cases and the MUEs in some cases. They do not override the add-on code edits. In order to use a modifier, it must be medically necessary to override the NCCI edits. You must have supporting documentation of the medical necessity before billing. Appending a modifier to override the edits without the supporting documentation and medical necessity is considered Medicare fraud or abuse. Next, what resources are available to help you with the NCCI edits? First, CMS offers a Medicare Learning Network or MLN booklet. This booklet is titled How to Use the Medicare National Correct Coding Initiative NCCI Tools. The booklet provides an overview of NCCI and how to use the edits. The next resource is the CMS website. The National Correct Coding Initiative Edits section will explain what the edits are and provide you with a list of the edits. Finally, watch our Encore video, Using Modifiers with NCCI Edits. The goal of the video is to help you select the correct modifier that would override the edit for your circumstance. Use the links in the description below to help you access any of these resources. That brings us to the end of my presentation. This is not the end of your story with the National Correct Coding Initiative Edits, or NCCI. Remember to review those resources and to bill correctly. If you found this video helpful, give us a like and a share. Want to know when we post new content? Subscribe to our YouTube channel. Have a question or comment on any of this content? Leave it for us so we can help you further. Want to give us your opinion on this video? Take the survey. The link is in the description below. Thanks for your time today. I appreciate you listening to this video. Have a great day, everyone.